Alright, so all that fat graft is oilless and bloodless. And so we are going to transfer oilless and bloodless fat into the bottle. So of course she's going to keep everything, right? And she's going to have much less risk of oil cysts, of course, and much less risk of blowout fracture or rejection of that fat graft. Thank you. All right, so I will be speaking at the California Academy of Cosmetic Surgery meeting in October 16 about how to prevent blowout fractures and oil cysts. And this is precisely what I'm going to say. You have to obtain the fat graft in such a bloodless manner to begin with. So when you put the fat into the bottles, it's pure fat, and we don't treat this fat graft in any way. There are commercially available systems to clean the fat of all the oil and all the blood, and of course they cannot get all of it out, right? So it's best to collect it this way, so we don't have to waste time doing that either, right? Waste time, we don't need to, right? Thank you. She's on her side, okay? The buttocks are over here. Look at that waist. I'm going to show you the other side, but we gave her a waist. Of course, she needs to do the belly. She needs to have a tummy tuck, but she didn't want to do that at this time. But I'm going to show you. This is called the pinch test. The buttocks are right here. So look at this. Look at the pinch test. See? We're down to like 0.5 centimeters here. Like, look at that. Everywhere I go. See? This is the pinch test here. See? Here. See? Basically 0.5 centimeters everywhere. Look at this, see? Incredible, see? Very good. So now we're gonna do it this way. So you can see here the pinch test on like this other direction. I don't know which one is better, which one seems better to you, but that's the way we do it, see? Incredible. Thank you. So she's on her side, the buttocks are over here, but I wanna show you how, here, look. You see the pinch? Remember how it was a half a centimeter? Here, you cannot pinch. And you don't have the waist, right? Look at all these. This is the pinch. It's huge. Look at that. Yeah, and I cannot grab less even if I want to. It's impossible, right? So it's all over it. And you'll see later on how it's gonna look, and we'll do the pinch test. Thank you. Wow, so look at that.
Ooh, look at this.
What do you see, huh?
It's glowing.
Glowing, huh? Incredible. Beautiful yellow pot. Thank you. So look at this. So look at the waist now, huh? How beautiful she looks. Buttocks are over here. This is the back. And again, we're going to do what is called the pinch test. This is the pinch test. We're at 0.5 centimeters on the pinch test. Look at that. Everywhere we go, 0.5 centimeters. 0.5 centimeters. Look at it, see? Everywhere we go. Beautiful. Beautiful, 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 beautiful. Remember how it was before, right? Now we're gonna go this way, see? See, this way. I don't know which one is better for you guys, but you can see buttocks are right here, and she is absolutely without any excess fat. Thank you. Wow, so look how beautiful this looks, huh? That's the high definition in the back. So this is the paravertebral muscles, and the buttocks are on this side. She just looks incredible. And this is the lines here, right? And there is also a line here in the middle right there. See? Right there. You can't see it, but there is a line there. Thank you. Alrighty, so now we're injecting the fat graft, which is oil-less and bloodless, into the deep subcutaneous space. According to the World Association of Gluteal Surgeons, we're doing this under ultrasound guidance. So I'm looking at what's going in. It's a beautiful bloodless, oil-less fat graft. What that means is that she's going to retain all this fat, right? Because it's not fat mixed with blood. It's not fat mixed with oil, and it's extremely safe because we're going into deep subcutaneous space according to the World Association of Gluteal Surgeons guidelines. So
I believe also that when you put oil here, then you get oil cysts. We never had an oil cyst, thanks to God. I want to keep it that way. But also, I believe that the famous blowout fractures, which is like a light bulb that sticks out in the buttocks, and we put 100 at a time, and we're going to move to the other side. So imagine having like a light bulb out here. It usually happens in this area and this area, between 3 and 5 and between 7 and 9. And I believe it is from the surgeon disrupting the anatomy of the buttocks, especially going from this incision past the central compartment. So there is 7 compartments on the buttocks, 3 lateral compartments, 3 medial compartments, and 1 large central compartment. From this intergluteal incision, I don't go past the central compartment because easily you can pierce the superior superficial fascia, and the fat graft herniates like a volcano into the skin. And because the superficial gluteal space is not as pliable, it's not as forgiving, it's got more fiber, then the fat graft finds the path of least resistance, and it blows up into the skin and blows up in like a ball here and here. And I believe also that is a foreign body reaction where the actual body is rejecting that blood that doesn't belong in there. So when you see surgeons and whatever they put in here is strawberry color, that means there's fat with blood. Or when you see oil here, fat and oil. But you can see oil-less, bloodless fat graft that has not been treated in any way other than we collected this particular fat graft in 500 ml of normal saline, and that's it. Thank you. Yeah, and the reason to do 100 on one side, move to the other side, do another 100 is so that the quality of the fat is similar, right? So that we are gonna be more symmetrical, right? Because we're not just putting all the fat graft in one side and then on the other side. So we go 100, then 100, to keep it more symmetrical and the quality of the fat about the same. So she looks incredible. I'm looking at the ultrasound, I'm looking at the patient, and I'm looking at this fat-less, at this oil-less, blood-less fat graft. Thank you.
Alright, we're doing ultrasound guided gluteal fat transfer. That means that we're using an ultrasound to visualize this gluteal space. We have the skin, we have the superficial gluteal fascia, which has a break right here, and then this straight white line is Dr. Patino's cannula. He's going to wiggle it for us. Wiggle, wiggle. And then under there we have the striated muscle and the deep gluteal fascia. So right here we have a little space where Dr. Patino can safely put fat.
Okay, so pay attention to the tip of that cannula. Show it to them. And tell them what's going to happen. 1, 2, 3, go.
So we're going to see a cloud of gray, and what that is the representation of fat going into this space. See how all of a sudden the superficial gluteal fascia got pushed up a little bit, the deep gluteal fascia got pushed down? That's because this gray cloud is fat entering this space.
Thank you.